Okay, so where is it? Aha. SCP-965 classified document. Yeah, that's correct. Object class Euclid. SCP-965 is contained within a framed, ready-to-install window, henceforth referred to as SCP-965-1, composed of at least 6 panes of clear glass or similar material, measuring at least 15 cm by 30 cm. SCP-965-1 must in turn be kept in an environmentally controlled storage facility capable of withstanding significant seismic disturbances. SCP-965-1 should be inspected at least once per week to check for degradation of material. At all times, at least 2 similar framed windows must be present and within separate chambers in additional padding and insulation, with no other window pane measuring greater than 14 cm wide or 29 cm tall between them and the current SCP-965-1. The lighting within the chamber containing SCP-965 must be at a minimum of 130 candelas at any time personnel are within said chamber, except during research. While SCP-965 is currently contained within SCP-965-1, our inability to control its movement upon destruction of SCP-965-1 through means beyond proximity have prompted its elevation to Euclid status. Research into a more permanent means to contain SCP-965 is ongoing, and individual experiments may be carried out by Clearance Level 1 personnel after approval by Level 3 administration. Let me just get uncomfortable also making sure this is all correct. SCP-965 is a visual manifestation that occurs within framed windows. This manifestation takes the shape of the shadowed face of an apparently pale-skinned male that is looking through the window. The exact details shown vary, as is the direction of orientation as well as the age of the person. However, sufficient detail shows it to consistently be the same being at differing points of its life, between the approximate ages of 10 and 55. Research into an individual matching SCP-965 has thus far proven inconclusive. SCP-965 will only appear when the relative lighting on the outside of the window falls below 5 candelas, regardless of the lighting on the inside. Such terms are possible because the face will only appear in a fully assembled window frame, although it does not need to be currently installed. Thus far, SCP-965 has not shown any ability to intentionally move from one glass pane to another, even within the same installation. It is only able to attain a new manifestation point upon the destruction of the current SCP-965-1, at which point its new habitat will be reclassified as SCP-965-1. The face is visible from the outside portion of SCP-965-1, but despite its two-dimensional nature, it is described as looking away into the room. Initial effect caused by SCP-965's reports of unease, nervousness, and low-grade paranoia. These sensations will overcome anything within visual range of the manifestation, even if obscured, such as by curtains. Based upon reports pertaining to residents of the house where SCP-965 was discovered encountering problems sleeping, experiments were conducted using D-Class personnel who were made to sleep in a chamber where SCP-965-1 was installed. An individual that is sleeping in any area visible to SCP-965 when it manifests will invariably have dreams of a disturbing nature, usually involving being chased, attacked, tormented, etc., though without physical contact within the dream. With repeated incidents involving the same subject, as she has 3, but never more than 10 dream cycles before onset. SCP-965 will begin manifesting with a more explicit smile than normal. After this point, the subject will begin complaining of heartburn or abdominal pain, and often begin to vomit blood or have blood in the bodily wastes. This is caused by the victim suffering ulcers and low-grade hemorrhaging through varied locations in their gastrointestinal tract. The current hypothesis as to the cause of these afflictions is SCP-965's influence artificially accelerating the body's reactions to elevated stress and fear levels. Subjects who advance to this stage have also reported continuing experiences of the facial manifestations in windows during dreams, as well as in the peripheral vision while awake, even after being removed from the vicinity of SCP-965. Most suffer from low-grade but lasting feelings of paranoia, as well as sensations that they are being watched or followed. Whether this is in fact some remnant influence left behind, or standard symptoms of distress followed by the traumatic intrusion of SCP-965 into their psyche, is under investigation. SCP-965 has produced no noise to date. There have been no reported instances of SCP-965 animating in any way once it appears. However, it is capable of disappearing and reappearing at will in different poses. SCP-965 also shows signs of sentience. It has been observed to show disappointment if it manifests into an empty room, irritation or anger when manifesting before someone that had broken a prior SCP-9651, and one instance of visible fear when in the presence of agent who had earlier participated in its retrieval. Let me just find the addendum, which is, I believe, in the database. There it is. Addendum Incident 965-1. Routine testing involving the destruction of SCP-9651 confirmed that a multi-paned window may act as multiple holding zones. Sufficient damage to the overall structure disqualifies it as a possible replacement. Unfortunately, SCP-965 instead manifested in an adjacent experimentation chamber's observational window. Due to the high standards of Foundation equipment, this required the window's complete removal and destruction via tactical breaching charge. SCP-965 was viewed with significantly hostile expressions for 1 month after the incident. Addendum Incident 965-2. A doctor requested transfer away from the project involving 965. She was reported as beginning to have visions of 965 and to experience feelings of paranoia similar to those affected during sleep, despite not having slept in the presence of SCP-965 herself. She was temporarily relieved of duties and assigned to psychological care. No other instances of SCP-965 affecting personnel who have not slept in its presence have been reported.